Are you over 60 and feeling more tired than usual, losing weight without trying, or brushing off strange symptoms as just aging? Too many seniors do exactly that, and it's costing lives. Because here's the hard truth. According to the American Cancer Society, nearly 60% of all cancers occur in people over 65. Yet countless cases go undiagnosed until it's too late. Why? Because the early warning signs often look like everyday aging issues until they don't. You might think, I'm just slowing down a bit, or this pain is just part of getting older. But in many cases, those seemingly innocent changes are the first whispers of something far more serious. In today's video, we're breaking down 8 subtle but medically validated early warning signs of cancer that seniors often miss or dismiss. These aren't sensational claims. They're backed by clinical research and used by doctors to detect some of the most common cancers affecting people over 60. And recognizing them early can dramatically increase your chances of successful treatment. So if you want to stay independent, protect your loved ones, and take control of your health as you age, this video is for you. Before we get started, drop a comment below. What's one health symptom you've ignored in the past, only to realize later it was serious? We'd love to hear your story. And don't forget to like this video and subscribe to the Wellness Vault for weekly health content designed to help seniors stay sharp, strong, and well-informed. Let's get started. Number 8 is unexplained weight loss in the absence of diet or exercise changes. If you're over 60 and notice the number on the scale going down, but you're not doing anything differently, it's time to pay close attention. Many seniors chalk up weight loss to eating less or stress, but when it happens without any intentional change in diet or activity, it can be a major red flag. Unexplained weight loss is one of the earliest signs of several types of cancer, including cancers of the pancreas, stomach, esophagus, lung, and even certain blood cancers like leukemia or lymphoma. These cancers can cause metabolic changes in your body, making it burn calories faster or impairing your ability to absorb nutrients. In some cases, tumors can increase inflammation or alter how your body processes food, all of which can lead to unintentional weight loss. Doctors consider a loss of more than 5% of your body weight over 6 to 12 months without trying as clinically significant. For a 160-pound adult, that's just 8 pounds. You might not notice it right away, but if your clothes are looser, your belt feels tighter, or friends comment on your slimmer appearance, don't brush it off. Other warning signs that often go hand in hand with this include reduced appetite, feeling full after small meals, or frequent indigestion. All of these could suggest that your body is struggling with something beneath the surface. The bottom line, if you're losing weight and you don't know why, don't assume it's a good thing. It could be your body's first whisper of trouble ahead. Schedule a checkup and ask for a full evaluation, including blood work and possibly imaging scans if appropriate. Number 7 is fatigue that doesn't go away. Everyone feels tired from time to time, especially with age. But if you're over 60 and find yourself experiencing a type of fatigue that lingers no matter how much you rest, it could be more than just a part of aging. Persistent, unrelenting fatigue is one of the most overlooked symptoms of cancer, especially cancers like leukemia, colon cancer, or ovarian cancer. This kind of tiredness doesn't improve with sleep or a few quiet days. It's deep, ongoing, and often interferes with your ability to perform daily tasks. Why does cancer cause fatigue? In many cases, it's due to how cancer disrupts your body's energy systems. Tumors can drain nutrients from your bloodstream, release inflammatory chemicals that sap your strength, or lead to anemia through internal bleeding, especially with cancers in the digestive tract or bone marrow. As a result, your body becomes less efficient at producing energy, even if you're eating and sleeping well. This kind of fatigue may also affect your mental sharpness, mood, and motivation. Seniors often describe it as bone-deep exhaustion that just won't go away. If you're finding it hard to stay awake during the day, skipping social outings because you're too tired, or needing naps just to function, don't ignore the signs. Ask your doctor for a full evaluation, including blood work to check for anemia, inflammation, and organ function. Catching the underlying cause, whether cancer or another condition, early can make all the difference. Number 6 is frequent or unusual bruising. As we get older, it's normal to bruise a bit more easily. Our skin gets thinner and our blood vessels become more fragile. But if you're noticing frequent bruises in odd places, like your back, stomach, or arms without bumping into anything, or if those bruises seem to appear larger, darker, or take weeks to heal, it might be more than just aging. Frequent or unexplained bruising can be an early sign of certain blood cancers, like leukemia. In leukemia, the body produces abnormal white blood cells that crowd out normal cells in the bone marrow, reducing the production of platelets, which are responsible for blood clotting. Without enough platelets, even a minor bump can result in extensive bruising. Other symptoms often tied to this warning sign include nosebleeds, bleeding gums, or tiny red spots on the skin called petechiae, especially on the lower legs. These signs may also show up in conjunction with fatigue, weakness, or frequent infections as the immune system becomes compromised. What makes this symptom particularly important for seniors is that many people assume bruising is just part of getting older. But there's a difference between normal bruising and patterns that suggest a deeper problem with blood cell production. If you notice bruises that are larger than a quarter, appear without explanation, or come with other symptoms like pale skin, dizziness, or shortness of breath, don't delay. Ask your doctor for a complete blood count, CBC test. It's a simple step that can provide valuable clues about your overall blood health and potentially catch a serious condition in its earliest stages. Number 5 is changes in bowel or bladder habits that persist. It's not unusual for bowel or urinary patterns to shift slightly with age, but if you notice a significant change that lasts more than 2 or 3 weeks, it could be your body's way of alerting you to something far more serious. For bowel movements, this might include chronic constipation, diarrhea, or a noticeable change in stool shape, like pencil-thin stools, or the sensation that your bowels aren't emptying completely. For the bladder, this could look like increased frequency, pain during urination, or the urgent need to go, even when your bladder isn't full. In seniors, these symptoms are often chalked up to diet, dehydration, or prostate changes. But they are also classic early signs of colorectal, bladder, or prostate cancer. These cancers grow slowly, which means symptoms can creep in subtly before reaching a critical stage. Blood in the stool or urine, often a sign people ignore or attribute to hemorrhoids or a urinary tract infection, should never be overlooked. Even a small amount of blood can be a significant indicator and warrants prompt medical evaluation. Equally important is tracking when these changes occur. If you're waking multiple times during the night to urinate, experiencing pain that doesn't resolve, or if the problem keeps returning despite treatment, it's time to push for a thorough diagnostic workup. Doctors may recommend a colonoscopy, urine analysis, or prostate-specific antigen PSA test, depending on your symptoms and risk factors. The key is not to delay. Dietary changes and hydration can certainly impact elimination habits, but those shifts are usually temporary. If you've increased your fiber intake, started a new medication, or recently recovered from an illness, it's reasonable to expect some irregularity. However, if these symptoms persist without a clear cause or worsen over time, it's critical not to dismiss them. Maintaining a journal can help. Note the color, consistency, frequency, and any discomfort associated with your bowel or bladder habits. This data gives your healthcare provider valuable clues and can help speed up diagnosis and treatment. Trust your instincts. If something feels off, it's worth getting it checked. All right, before we get into the final 4, and trust me, they're the most critical, let's take a breath and reflect on what we've covered so far. We talked about unexplained weight loss, that silent and sneaky symptom that could mean your body is fighting a hidden battle. Then came fatigue, not the normal kind, but the bone-deep exhaustion that sleep doesn't fix. After that, we explored the concern of unexplained bruising, showing up in places it shouldn't and lasting longer than it should. And most recently, we unpacked the often ignored but crucial signs hiding in your bowel and bladder habits, little changes that can point to something far more serious beneath the surface. Now here's the thing, these first 4 signs are important, but the next 4, these are the ones that doctors say are missed the most. They're often disguised as aging, written off as no big deal, or brushed aside until it's far too late. So if you're still watching, I want you to do something right now. Drop a comment below that says, still watching, so we know you're with us. And let us know, which of the symptoms we've covered so far surprised you the most? Your insight might help someone else catch something early, too. Now let's get into the final 4 warning signs, the ones your future self will thank you for knowing. Number 4 is skin changes, or wounds that don't heal. As we age, our skin naturally becomes thinner, drier, and slower to heal. But when a cut, sore, or skin irritation lingers for weeks without improvement, or even gets worse, that's a red flag that should never be ignored. Unhealed wounds, changing moles, or new growths on the skin can all be early signs of skin cancer, including basal cell carcinoma, squamous cell carcinoma, and melanoma. These are the most common cancers in seniors, but there are also some of the most treatable, if caught early. Here's what to watch for: a mole that changes shape, grows in size, develops uneven borders, or shifts in color, a flat patch of skin that becomes scaly, crusty, or itchy, or a sore that bleeds, crusts over, then reopens again and again. You might think it's just a bug bite or a harmless skin irritation, but cancer can hide in plain sight. One particularly dangerous form, melanoma, is known for its ability to spread quickly to other organs. It can develop not only on sun-exposed areas like the face, neck, and hands, but also on the soles of the feet, palms, or under fingernails, places most people never think to check. If you're a senior, you should be checking your skin monthly. Use a mirror or ask a loved one to help check areas you can't see, like your back, scalp, or behind your ears. And if something looks unusual or hasn't healed in 3 to 4 weeks, get it looked at by a dermatologist immediately. Skin cancer doesn't always look scary at first. Sometimes it looks like nothing at all. That's why vigilance, routine checks, and follow-ups are key. In many cases, early treatment can mean the difference between a minor outpatient procedure and life-threatening complications. Number 3 is persistent cough, hoarseness, or shortness of breath. A lingering cough is one of those symptoms many people ignore, especially as they get older. After all, it's easy to blame on allergies, dry air, acid reflux, or an old smoking habit. But if that cough sticks around for more than 3 weeks, it's time to dig deeper. A chronic dry cough, or one that produces phlegm or blood, can be an early sign of lung cancer, which remains the leading cause of cancer death in both men and women over 60. Even more concerning, many early lung cancer symptoms mimic harmless conditions, which is why they're often overlooked until the disease has already progressed. And it's not just the cough. Hoarseness or a raspy voice that doesn't clear up after a few days can signal cancers of the larynx or throat, especially in seniors who have a history of smoking or vocal strain. Shortness of breath, even with light activity, may be dismissed as a result of aging or lack of fitness, but it could point to something much more serious. In some cases, these symptoms are caused by tumors pressing on the airway or interfering with lung function. Other times, cancer cells in the bloodstream lead to inflammation and fluid buildup in the lungs, making breathing harder. Here's what to pay attention to: a cough that's dry or wet, especially if it wakes you at night. Any trace of blood in your saliva or mucus. A voice that sounds different for more than 2 weeks. Or new shortness of breath when climbing stairs or doing simple tasks. If you're experiencing any of these, ask your doctor for a chest X-ray or CT scan. These are quick, non-invasive tools that can detect abnormalities in the lungs early, often before you even feel sick. And remember, you don't have to be a smoker to get lung or throat cancer. Environmental exposures, secondhand smoke, and even certain viruses can contribute. That's why no symptom should be dismissed without investigation, especially if it's new, persistent, or getting worse. Number 2 is persistent pain that doesn't go away or worsens at night. Pain is one of the most common complaints as we get older. Aches and stiffness come with aging joints, past injuries, or arthritis. But there's a critical difference between typical age-related discomfort and pain that signals something far more serious. If you're feeling pain that comes out of nowhere, sticks around for weeks, or gets worse at night, it's time to take it seriously, especially if it's deep, dull, or located in one specific area, like your back, pelvis, or abdomen. Persistent pain can be an early indicator of several types of cancer, including bone cancer, pancreatic cancer, ovarian cancer, and even metastatic cancers that have spread to the bones from elsewhere. In these cases, the pain isn't just an annoyance. It's your body's alarm system telling you something is off. One red flag to watch for is pain that intensifies when you're at rest, lying down, or sleeping, because inflammatory cancer activity often increases at night. Another warning sign is pain that doesn't respond to over-the-counter medications or lifestyle changes and gradually gets worse, not better. Sometimes the pain feels like deep pressure or a constant ache. Other times it may come with other changes, like unintentional weight loss, fatigue, or changes in appetite. In bone cancers, the pain may even cause visible swelling or tenderness at the site. The challenge is that many seniors write off this pain as just part of getting older, but pain without a clear cause that disrupts your daily life or keeps you from sleeping needs to be investigated. Don't settle for vague reassurances. Ask for imaging, an X-ray, MRI, or CT scan to rule out serious conditions. And if your doctor doesn't take it seriously, seek a second opinion. Pain may be common in older adults, but it's not something you should just live with, especially when it could be your body's first and only warning. Number 1 is unexplained bleeding from any part of the body. This is perhaps the most urgent and unmistakable warning sign on the list, yet it's still one of the most ignored. If you notice bleeding from places where it shouldn't be, especially if you can't trace it to an injury or a known medical condition, it's time to act immediately. That means blood in your stool, urine, saliva, or after coughing. It also includes postmenopausal vaginal bleeding, which should never be assumed to be normal, even if it seems light or sporadic. Each of these could signal a serious underlying issue. Blood in the stool may point to colorectal cancer. Blood in the urine could be a sign of bladder or kidney cancer. Vaginal bleeding after menopause is a potential red flag for uterine or cervical cancer, and coughing up even a small amount of blood could indicate lung or throat cancer. These symptoms often start subtly, maybe a little red on the tissue, a pinkish hue in the toilet bowl, or spotting that seems like it'll go away on its own. But any bleeding that isn't clearly explained by a known condition, like hemorrhoids or a minor cut, should never be dismissed. What makes this especially dangerous is that many people delay telling their doctor out of fear, embarrassment, or the hope that it will just go away. But cancer doesn't wait, and early intervention can make the difference between a simple, outpatient procedure and a much more serious diagnosis. If you notice unexplained bleeding of any kind, track it. Write down when it happens, how much there was, and whether it came with any pain or other symptoms. This kind of detail can help your doctor make a faster, more accurate diagnosis. But most importantly, don't wait. Every day you delay is a missed opportunity for early detection. And when it comes to cancer, early detection saves lives. So, let's take a moment to review what we've covered, because this information could truly save a life. We started with unexplained weight loss, a silent but serious symptom that often points to cancers of the digestive system or blood. Then we moved on to persistent fatigue, the kind that doesn't go away with rest and may signal your body is under internal attack. We talked about unusual bruising, a common but overlooked sign of blood cancers like leukemia. We then explored persistent changes in bowel or bladder habits, early indicators of colorectal, bladder, or prostate cancer. Midway, we emphasized that even common symptoms can become dangerous if they persist. And we urged you not to dismiss these changes as just aging. From there, we covered skin changes and wounds that don't heal, highlighting the importance of early detection in skin cancers. We discussed lingering coughs, hoarseness, and breathing issues, potential signs of lung or throat cancer that are frequently brushed off. We then talked about chronic or worsening pain, especially at night, that may point to bone, pancreatic, or metastatic cancers. And finally, we ended with the most critical warning, unexplained bleeding. No matter how small, this symptom always deserves immediate medical attention. These signs may seem subtle, even ordinary, but in the context of aging, persistence is the key. If any of these symptoms have lasted longer than 2 to 3 weeks or are getting worse, do not wait. Make an appointment, ask questions, push for answers. Now we want to hear from you. Which of these signs were new to you? Have you ever experienced one and brushed it off? Drop your thoughts in the comments. We read everyone, and your story could be the spark that gets someone else to take action. If you found this video valuable, give it a like. It really helps the channel. And don't forget to subscribe to the Wellness Vault for more clear, science-backed health guidance made especially for seniors and those who care for them. Your health is your greatest asset. Protect it, prioritize it, and remember, you deserve to feel heard, understood, and empowered. Thanks for watching, and we'll see you in the next video. Stay sharp, stay strong, and stay well.